Hi everyone. For my assessment critique, I chose the Yale Brown Obsessive Compulsive Scale, or YBOCS. This assessment is considered the gold standard for assessing the severity of obsessive compulsive disorder, or OCD. It's a clinician administered assessment that's primarily used with adults who have been diagnosed with OCD or are suspected of having it. One thing that's important to know about this assessment is that it's not used to diagnose OCD. Instead, it measures how severe a person's obsessive and compulsive symptoms are. Clinicians use it to help with treatment planning, monitoring progress throughout therapy, and evaluate whether a client's symptoms are improving over time. The YBOCS was developed by Goodman and colleagues in 1989 um, because there was a need for a standardized way to measure OCD symptoms. One thing that makes this assessment unique is that it focuses on the severity of symptoms rather than the specific content of a person's obsessions or compulsions. For example, one person with OCD might struggle with contamination fears, while another experiences intrusive religious thoughts or fears of harming someone. Even though these symptoms look very different, the YBOCS measures how much distress they cause, how much time they take up, how much they interfere with daily life, and how much control the person feels they have over them. For my paper that I wrote, I focused on adults aged 18 and older who have been diagnosed with or are suspected of having OCD. And this population was chosen because I'm interested in working with adults who have OCD in my future counseling career. Adults with OCD often experience significant distress and impairment in everyday functioning. Many also experience anxiety or depression at the same time. Another challenge is that many people with OCD don't openly talk about their intrusive thoughts because they feel embarrassed or they might be ashamed. Since the YBOCS is a structured interview, it gives clinicians a more consistent way to ask about symptoms that clients might not otherwise bring up on their own. Another reason this assessment is so widely used is because it's very helpful throughout treatment. Like, as you go on with therapy, clinicians can administer it multiple times to see whether symptoms are improving, staying the same, or getting worse. It's also commonly used in research studies, and because it allows, or it's used in research studies because it allows researchers to measure how effective different treatments like CBT or medication are over time. That's cool. Moving on to the reliability and validity. One of the most important things to look at when evaluating any assessment is the reliability and validity, like we talked about in class. And just as we know, reliability refers to how consistently an assessment measures something. So like if the assessment is giving multiple times under similar conditions, or if different clinicians administer it, we would expect the results to be fairly consistent. And um, generally speaking, for the Cronbach's alpha, which measures internal consistency, a score of 0.70 or higher is considered acceptable, 0.80 or higher is considered good, and 9.0 or 0.90, sorry, or higher is considered excellent. Um, so then, when looking at the study that I was reading about by Goodman and colleagues, it was reported a Cronbach's alpha of 0.89, which indicates excellent internal consistency. That tells us the questions on the assessment work well together to measure OCD symptom severity. The researchers also found high inter-rater reliability, which means different clinicians gave very similar scores when evaluating the same client. That's important because it shows the assessment produces consistent results regardless of who administers it, as long as they're properly trained. And one area that was a little weaker was the test-retest reliability, which was 0.61 over about 48 days. The researchers believe that this was probably because so much time had passed between assessments and because different interviewers administer the measure. Overall, the research shows that the YBOCS performs very well when it comes to reliability, which is one reason it's still considered the gold standard for assessing OCD symptom severity. And then moving on to validity. Validity refers to whether an assessment is actually measuring what it's supposed to measure. The YBOCS has strong construct validity, meaning it was designed specifically to measure the core features of OCD symptom severity, such as distress, interference in daily life, time spent on symptoms, and perceived control. It also has good convergent validity, which means its scores are similar to those of other well-established OCD assessments. One limitation is its discriminant validity. Researchers found that YBOCS scores were moderately related to measures of depression. Since people with severe OCD often experience depression as well, the assessment doesn't always clearly separate the OCD symptoms from the depressive symptoms. Overall, though, the evidence shows that YBOCS has strong reliability and validity, making it an effective assessment for measuring OCD symptom severity. Okay. The YBOCS is administered as a structured clinical interview by a trained mental health professional. It usually takes between 15 and 30 minutes, depending on how complex the client's symptoms are and how much discussion takes place during the interview. Since the clinician is responsible for rating symptom severity, it's important that whoever administers the assessment has experience recognizing different OCD symptoms and understands how the scoring system works. The assessment includes 10 severity questions, 5 questions focus on obsessions, 5 focus on compulsions. Each question is scored from 0 to 40, so the total score ranges from 0 to 40. Sorry, I meant each question is scored from 0 to 4, so then the total score ranges from 0 to 40. Okay. The assessment also includes a symptom checklist that helps identify the type of obsessions and compulsions the client experiences, but the checklist itself isn't scored. Instead, it's used to guide the clinical interview. After completing the interview, the clinician adds together the scores from all 10 items to calculate the total score. Generally, higher scores indicate more severe OCD symptoms, while lower scores indicate milder symptoms. However, it's important to remember that the YBOCS doesn't diagnose OCD again. It just provides information about the severity of symptoms. And one of the biggest strengths of the YBOCS is that the clinicians can repeat it throughout treatment because it's sensitive to changes in symptom severity. It allows clinicians to objectively measure whether treatment is working and whether the client's symptoms are improving over time. Overall, after reviewing the research, I think it's easy to understand why this assessment is considered the gold standard for assessing OCD symptom severity, since it does have strong reliability and validity backed by research. But yeah, I would feel confident using this assessment in clinical practice as part of the comprehensive evaluation because it provides really valuable information about symptom severity while helping guide treatment planning and monitoring progress. So that is all. Thank you.